Hi everyone, we are back. We're doing the second part of our treatment. This is going to be Viva. It's the radio frequency microneedling. This treatment actually works a little bit more superficial on the skin. It's really great for superficial texture and then also hyperpigmentation. So it's going to even out the skin tone, just make everything look nice and uniform. So we're going to start on the forehead. I'm going to turn to the side. There we go. So we make really small advances. You want to have a really nice even treatment field. If you look really closely, you can see the very small little perforations in the skin. They almost look whitish. This is what the pins look like on this device. And so when they come in contact with the skin, we deliver the radio frequency, and that gives you a little bit of that tightening, shrinks down some of the pores, so the surface of the skin just looks a lot tighter and nicer. Really great for fine lines. This is probably one of my favorite treatments around the eyes. It's nice and small, so you can get pretty close, and it makes a really nice improvement on that hard to treat skin area. So we're just going to continue here with a little bit of overlap so we're consistent. As time goes on, you're going to see a little bit of that redness start to settle in. That is one way that we make sure our treatment is seamless. How are you feeling?
Fine.
Okay, good. So we're just going to continue over the whole area.
What kind of results are you going to see?
The result that you'll see is an improvement in pigment, some of these little brown spots that we see here, like this one for example, this little spot here, they'll lighten over time. I think that within about a week or two, around 3 weeks, the results just get better and better, and the pigment just starts to fade away. With this, maintenance treatments or multiple treatments give you the best result, but they're also really great in combination with other therapies. There are devices that penetrate a little bit deeper. This one works a little bit more superficially. And this one also targets the color in the skin, the pigment, those areas of brown or discoloration. And not all radio frequency microneedling targets that, so that makes this device really unique. You can expect a little bit of redness for a couple days, some warmth in the skin from the energy that we're putting into the tissue. After about 2 days, that really settles down. This is not a lot of downtime, but packs a nice result. So I would say by tomorrow evening or the next day, he'll be looking great to go out about. I would just be careful with the sun. And then the results improve over the following days and weeks. I don't know if you guys can see that texture there. Kind of like a little pinpoint grid that we're seeing. You can see the demarcation line between treated and untreated. And so we're just going to continue on. And we'll cover the full face with this. Sina, any questions?
No, I believe you cover them all.
Perfect.
How frequently can you do this?
You can do this treatment every 2 weeks, every 4 weeks. It really depends on what the end goal is. If we are trying to correct an issue as opposed to just maintaining or preserving like a really nice overall skin texture, you would want to start a little bit more frequently if you're correcting something like large pores or scarring. But if you are just maintaining, monthly is really great.
Combinations of other treatments?
Combination treatments would include things like Fractura or Clear and Brilliant, any kind of laser for color like IPL, which targets reds and browns in the skin. They just work a little bit differently. Because this is radio frequency and it's energy as opposed to heat, you can combine it with heat therapies or with light therapies very safely. And they just target a lot more concerns in one treatment than if you were to spread everything out. Of course, it's important to work with someone who knows how to combine these different treatments, but some of my favorites include doing laser genesis with the radio frequency microneedling, doing Fractura, which gives you deep tightening and lifting in the skin with this one, which is great for superficial and the pigment. Or even just with an IPL, you can combine treatments. Clear and Brilliant, which is great for both texture and pigment. A lot of options.
Would you mind explaining what you combined this treatment with, what we did before?
Yeah, so we used Laser Genesis prior to this.
A little louder, please.
Laser Genesis was the treatment that we used prior to this. It was to treat the generalized redness that he's experiencing on the face. Basically, by shrinking down those blood vessels and constricting everything, we can reduce the appearance of the red. Combining this is totally safe on top. The radio frequency, even though it is red at the moment, actually also helps to constrict those vessels. Little superficial vessels, things that we get kind of around the eyes or around the nose, those all respond really well to this. So these little needles come in contact with the surface of the skin, penetrate, and then deliver the energy. That's what we're seeing and hearing as these little lights go and the sound is continuing on. Once it stops, it is finished with delivering the energy. You can set it to different strengths depending on skin type and concern, or if it's their first treatment versus someone who has continued to treat their skin and maybe is a little bit more used to it, could tolerate a higher setting. With radio frequency, one of my favorite features that makes it so wonderful in a practice with a very wide demographic is that it's safe for all skin types. So you can treat a variety of concerns in a variety of skin types and not worry about causing much risk or not causing much damage. We worry most frequently about hyperpigmentation, and this is something that improves pigment. Radio frequency is neither heat necessarily, nor not a laser type heat or light. So it's very good and safe for all patients.
How does it feel for our patient?
I really don't feel much at all.
We just used topical numbing. We didn't have anything oral for pain. Topical numbing is pretty great for this. They're comfortable, it lasts long enough. It can make the skin a little bit more flushed and red looking prior to treatment, but it all wears away shortly after we treat the area. He's very comfortable even after having the first treatment performed. And downtime is really minimal. Most of the time, what patients will experience having this treatment, the radio frequency microneedling, they will be red for a couple days. Some patients respond with more redness than others, and sometimes they'll have a lot of redness one treatment and not the next treatment. So there's a lot of variables. I know that personally, I've had a lot of redness with one treatment and then next to no redness with another treatment. And after a few days, you may feel like little sandpaper-like scabs. Those wash away as you wash your face. They're usually gone within 5 days or so. Really minimal. They're not usually visible to anyone. You just feel them yourself if you're putting on sunscreen or applying some makeup or moisturizer.
And Dr. Emer has a strict protocol for aftercare regimen
Very
that he
strict
goes
for
over with his
aftercare.
esthetician.
So as you can see, it got really nice and close to the under eye. This is, if we can feel it, this is the rim of his orbit. And so I'm treating, you can see his lashes right here. I'm treating pretty much right up to the lash line. I can pull the skin down, and I'm not sure if it's too shadowed, but you can see right up to here that there's marks from where we got the microneedling. So that's gonna tighten up any crepey skin. We can treat right along here to prevent crow's feet from forming or worsening. It's great in combination with things like Botox or other neuromodulators. We're gonna switch over to the other side and we'll continue here.
Want to wrap it up?
Yeah, so we're just going to go ahead and treat this other side. We're gonna do the exact same thing up throughout the eye. Again, this was radio frequency microneedling with Viva. I love this device because it not only tightens the skin and works on crimpy texture, but it addresses areas of dark spots, hyperpigmentation, with very minimal risk or downtime. So we can get really nice and close and the patient's comfortable. We're gonna go ahead and finish up, and we'll see you soon for some other results and videos. Thank you.